Hey everybody, welcome back to Disabled Nurse TV. This is another poolside edition of education. Okay, so today we're going to talk about sepsis. Okay, SEPSIS. I didn't know as a baby nurse that when I went to work and older people had sepsis, it was like basically a mini psych ward because things get crazy, and that's when restraints are actually used and necessary to keep people safe. So this is going to happen to your parent, or it might have happened before, and we're going to talk about it right now. It's very important, okay? So sepsis is when the whole body, the whole system is infected, okay? So let's talk about infections. So let's say I cut my arm right here, right? And it's red, and it's just in one spot, okay? That's a local infection. It just stays in one spot, and you put your little Neosporin, you put your Band-Aid, you keep it clean, and it gets better, and it gets lighter pink, and it's healing, okay? Well, let's say it gets more red and starts to spread, okay? Spread, sunshine stuff. Spread, and it gets into the system, it spills into the blood. When that normally happens is with pneumonia in our patients. So they get a lot of bacteria in their lungs, and then it spreads into the body. And once again, that pump, our heart pumps that blood through, and that infection goes everywhere. And it confuses the brain, okay? And then people are trying to drive cars they haven't driven in 50 years. Some people are seeing spiders coming down from the ceiling. It gets wild, okay? So when you go to the hospital, once again, you ask for the blood. And in the blood, we're looking for lactic acid. If there's any lactic acid, means there's blood in the system. Okay, it starts with like a little confusion, like, oh, that's weird. It happens a lot with diabetic people that get dialysis, like the dialysis site in their body gets infected from going in and out, and it might not be clean. So that's usually what happens, or a UTI, okay? It's very common things. But you need to go to the hospital, and you need to ask for lactic acid, okay? And then that means that that person needs to be treated with antibiotics, and they go into this little fog, and after about 2 or 3 days, they wake up and they go, "Am I at the hospital?" And you're like, "Yeah!" I mean, from wild screaming to, "Hey, what's up, Steph?" So that's a little session on sepsis, okay? And for all my new grads, that's what the mini psych ward and unfortunately restraints are necessary for, to keep those people safe, okay? Talk to you soon. Love you. Bye.